Hi everyone, my name is Delene Grant and welcome to part 9 of my presentation on CPP Disability Ontario and Nicolini Law. Ada Nicolini and Ashleen Steele. I'm still on 2022. Okay, continued. Okay. Again, as I brought this section forward, it's in regards to Adrian Nicolini and his deception, and I was denied by CPP disability and my doctor. Okay, there was no contract, no contract with Adrian Nicolini except for WSIB. Okay. 2022 part 3 of 3 recap as per CPP biased decision dated April 12, 2022. And again, I brought these forward because it's still in relation to the decision, okay, because they said that I did not follow medical advice. And so far, I believe you think I did, okay? You would agree, okay? Please feel free to pause and read. And as I said, you're already familiar with the documents that I would be presenting. I have included them so that just to build my case, to let you know definite that I followed doctor's advice. Okay, thank you. Dr. Sam Silverberg, compliance number 4. I did comply. I did not return to work effective April 2nd, 2018. Okay, my injury was 1 year and 5 months when I saw Dr. Sam Silverberg. As per Dr. Sam Silverberg report, Dr. Sam Silverberg's report and email response from WSIB lawyer Adrian Nicolini, I should not return to work unless I was placed elsewhere in a position that would not cause further injury to my hand. Okay? Dr. Silverberg's report, please feel free to read. Okay? And he had indicated, I do not anticipate improvement in the future. He said here, even with a local cortisone injection, the patient will not, in my opinion, be a suitable candidate to return to her previous vigorous skateboarding job. Okay. I received this email from Manulife Insurance, Adele Belsile, on January 2nd, 2018. No, I did not wish to speak with this person. Each time I speak with this person makes things worse for me. Okay? This person would take my conversation and dissect it, misconstrued it, and then present it in a way as if I am in the wrong. Because of this person, right, Bill Mobility has seized my salary and my benefits. Okay, I was bullied by this person, and this person was adamant in saying that I actually was refusing treatment and treatment was reoccurring and all these things, right? I didn't wish to speak with this person, so I asked Adrian Nicolini to get involved. He wasn't copied in because he wasn't involved as yet. Okay. However, I'm talking about here Dr. Silverberg's right advice to me, right? However, I communicated to her. I didn't really say much because to me, the report is supposed to have received Dr. Silverberg's report, which was dated November 17, 2017. Okay, this is now January 2018. So I spoke with her and I told her that she said here, you stated you had seen another specialist and was advised that injections were recommended. I did make mention other information regarding the injection to her. However, she chose to stop at recommended to give an impression that, okay, this second specialist, okay, recommended the injection and then I refused it. That's what actually she's trying to say here. When I did elaborate, right? And then she went on to say, you also stated that the hospital would have refused to do it. No, I did not say that. And also, there was information that I provided to her regarding the hospital. Okay, then she went on to say, however, we note that you refused the injection on July 26, 2017, as per the consultation report from Dr. Chris Karkis of July 26, 2017. Okay, again, Dr. Chris Karkis should not have offered me the cortisone injection because there was no inflammation, right? Clearly, the regulation said if there's inflammation, inject. There was no information, so she shouldn't have asked me. Dr. Chris Karkis set me up. Both herself and Dr. Handelsman set me up because as per information on this, when I look it up here, okay, it says cortisone injection. What is this used for? Inflammation. It's an anti-inflammatory medication. So why was this insurance lady, Manulife Insurance, Adele, why was she insistent that I take this injection? It was not needed. Was she trying to hurt me? Cortisone injections for inflammation. If there's no inflammation, why is this person who is not a doctor was still insisting that I take this injection? Okay, please feel free to pause and read if you can, if you wish. Thank you. Okay, I received another email from Manulife Insurance, Adele Belzile, on Tuesday, January 16, 2018, but this time Adrian Nicolini was copied in on it, my WSIB lawyer. I really didn't want to talk to this lady anymore, okay, because when I do, it's all lies. So this time it was a breather for me. Oh yes, someone I can now breathe. I can breathe. The lawyer is now involved, but I really thought this lawyer was in my corner all along. I really thought he was, Anyway, I was just thinking that she could no longer lie on me. Okay, so here she said, your lawyer noted that you saw Dr. Silverberg on November 17, 2017. She already knew that. So why is she saying that now? She already knew that, okay? But now she's saying the consultation report is not available in your GP's clinical file. Oh, how convenient. Okay, I did make mention about the report and I did spoke with her about the cortisone injection, right? And what the second specialist said, it was noted on January 2nd email when she made mention of it, that I said that another specialist recommended the injection. Okay, so why she been playing as if she didn't know that I went to a second specialist? Okay, what happened next is that Ashlyn Steele of Nicolini Law, right, on the 17th of January 2018, the following day, she forwarded Dr. Silverberg's report to Manulife Insurance, Adele Belzile. Okay, she said, kindly find attached Dr. Silverberg's report dated November 17, 2017. Then she said, Dr. Silverberg's report is quite clear that Miss Grant is unable to return to her pre-disability duties at this time. Please feel free to read. I've already been through this on Manulife's presentation. Okay, please feel free to read. Thank you. Okay, I've extracted the information. Okay, this information from here. All right, as you can see, I'm gonna just inform you about Dr. Silverberg's section. Okay, it says here, despite Dr. Silverberg's comment regarding his opinion on your ability to resume work in your current role, we feel that this treatment should be considered prior to forecasting this conclusion. Dr. Silverberg is a professional. Dr. Silverberg was the one who questioned me. Dr. Silverberg was the one who examined me. You understand? So he and this, I can read cortisone injections for inflammation, and it already, and based off the information here about tendonitis injury, it was already too late. So Dr. Silverberg was on point. He did not need to give me any type of medication, as he said it will not work. All right, it says, however, it says here on this report, however, healing time can sometimes take weeks or months or a year, depending on a patient's innate healing capacity, as well as other factors. And it also says here, if a tendon injury, if a tendon is injured but allowed to go untreated, it will take longer for treatment to take effect once begun. You understand? See, it will take longer for treatment to take effect once begun. Usually, serious treatment begins only when the symptoms become more difficult. You see, in my case, my situation was where it was chronic. Now it was difficult. I did not get the proper care for my hand, and Dr. Silverberg said the cortisone injection will not work. Yet Life was not a doctor. Is saying that his opinion basically doesn't count. He should have considered treatment prior to coming to his conclusion. What is that? He's a specialist. He's a doctor, so he knew what he was talking about. You understand? Life, I don't understand their comment here. Okay, so again, Life Insurance was ignoring Dr. Silverberg's report. Okay, and accepting Dr. Handelsman's report and saying that I refused the injection. Okay. They don't think we should be smart people, I guess. Okay. About the cortisone injection, my life insurance company was persistent that I took this injection, which would have been a non-effect. I don't understand. Right? There was no fluid, and this insurance company wanted me to take the injection. I told you, Rose contacted me, and I told her what the doctor said about the cortisone injection. Rose, my other co-worker, right? And she took the injection, and she went back for the injection. And I think she went back for the injection. I'm not sure how many times she took the injection. Cortisone injection, that is. And her doctor said, no more. And she told me, it's like she's in worse pain than ever. So, were they trying to hurt me? No, I would not allow that. So Rose followed Life's instruction, right? And it did not help, because she went over and over to her doctor for the injection, and at the end of the day, he had to cease giving her the injection, and she's still in pain and worse than ever. Okay, please feel free to pause and read. I already went through this in Life Insurance presentation. Okay. Okay, CPP disability indicated based off the report that they received. It says that I refused treatment. I refused the treatment in 2018. Okay, he said the injection would not fully resolve the condition, but it would reduce pain and inflammation. There was no inflammation. Who said that? Because it says here, Dr. Silverberg also recommended cortisone injection and notes the appellant refused the treatment in 2018. Dr. Silverberg did not say this. He said the injection would not fully resolve the condition, but it would reduce pain and inflammation. Where did he say that? Right? He said it would not work. So here this is a deception by CPP disability. Okay? Cortisone injection is for inflammation. It's an anti-inflammatory medication. Okay, and I've been through this section in my previous presentation on Dr. Handelsman. Okay, One life insurance company requested a description of function abilities form to be completed by the office of Dr. James Chang. And that's an overview because I've been through this already on the Manilife's presentation, right? Wherein Manilife Insurance ignored Dr. Silverberg's reports and also functional fitness form. However, Manilife Insurance sent the form to Dr. James Chang, and Dr. James Chang didn't want to complete it, so it was handed over to Dr. Silverberg. Okay, Manilife did not like that at all. Okay, Manilife did not ask Dr. Sam Handelsman for a functional fitness form. Manilife did not ask their insurance doctor for a functional fitness form. Okay, they asked Dr. James Chang, and Dr. James Chang knew that he would have to side with Manilife Insurance, so he didn't want to complete it because he knew he had to lie on it. You understand? Dr. Silverberg decided to do so, and Manilife did not like that. Please feel free to pause and read. Okay, thank you. So here, on February 10, 2018, Dr. Silverberg completed the form, the functional fitness form, okay, and he answered the questions. Even Manilife asking in the question here says, if this was Dr. Chang, my God, oh wow, I thank God that he didn't complete it because he would have lied on this report, right? It says here, we noted that cortisone injections were recommended by Dr. Handelsman, but the patient refused the injections on July 26, 2017. Considering the reoccurring presentation, right? You hear the word here, reoccurring. My situation was not reoccurring, just that they were lying about my situation, okay? Considering the reoccurring presentation of the symptoms, do you agree that this treatment should be considered, right? And Dr. Silverberg said a patient has a right to refuse any treatment. I suspect that a cortisone injection will not completely abolish her pain. Cortisone injection reduces inflammation but does not heal an injury. Therefore, her response would be part at best. Go figure, huh? And here he said that she injured herself on performing her job, and the pain will increase if she returns to that job. What do you get from that, eh? Okay. On February 10, 2018, Dr. Silverberg completed the description of functional abilities form, which was faxed to Manilife Insurance. Okay, so Manilife Insurance realized that it was faxed by Dr. Silverberg. Then I was forced to see their specialist. Okay, please feel free to read. Okay, I extracted information from the form and this is it. Questions and the comment from Dr. Silverberg. Okay. Here, Adrian Nicolini, during that time, so this is now April 2018, my salary had ceased, okay, effective the 2nd of April 2018, salary and benefits. Okay, so I reached out to Adrian Nicolini, the lawyer, and he indicated, Idelaine, FYI, you are under no obligation to return to work, especially when the doctor, that is Dr. Silverberg, is telling you not to go. Okay, it's in writing here. Okay, this is from the lawyer, WSIB lawyer, who I thought was in my corner at the time, right? That said, you will not receive a salary or short-term disability while we sue your benefit provider. Okay, please feel free to pause and read. Thank you. Here it says on the 15th of May 2018, this was when, as I said, sometimes you're so honest and people, what you say can be used against you. 15th of May 2018, I actually received the final warning letter, I think. Anyway, I was getting warning letters from Bell, right? And I said, Adrian, yes, I am still up. This is what Bill is doing to me. I fall asleep sometimes 3 a.m. or 4 a.m. So much on my mind. Okay. I have sent you 2 emails. If I do not return to work in my position, I'll be terminated as per letter from my supervisor. Please advise. Thank you so much. Then Adrian Nicolini responded, hello, Delay. Your choices remain the same. Return to work, you cannot do. Or 2, apply for AI sickness benefits and CPP disability. This is when you see in May he's talking about May he was talking about CPP disability, right? Anyway, please feel free to review. Thank you. Okay.